Prior to my director position, I was the principal at Irving Middle School. My goal was to be out front in the morning every day when kids arrive and interact with them. We built strong relationships where they would share with us some pretty tragic stories, which was good. But what do we do with that? What's the next steps?
I'm having conversations with many school districts across the state of Idaho, as well as school administrators and parents. And youth behavioral health, student mental health, and behavioral health supports for all children and families has really been a top priority and a top issue.
I was concerned with the mental health of students. I was concerned with the resources that we had available, the funding that we had available, and just realizing that we're not meeting the needs of our students.
The important part of Healthy Minds Partnership is having someone to address those very critical needs of students that are rising to the top, if you will, of having a behavioral health issue or a behavioral health crisis. Healthy Minds Partnership started back in 2017, initially with work that the Blue Cross of Idaho Foundation for Health started with the Nampa School District. They saw great results by placing a school-located clinician in the schools to provide behavioral health support to students, and the program has really grown from there.
I opened my arms and said, let's do this. Let's apply for the grant. I know there was quite a few schools in this area applied for the grant. I received the grant. I worked with Healthy Minds and Blue Cross through that whole year, and it was so amazing.
The Healthy Minds Partnership Roadmap is really just, in the sense, a toolkit, written down instructions that identify how schools can connect and build this out on their own.
That roadmap, it really did outline and lay out how I can offer an amazing opportunity and resource for the parents and families in need.
The first idea really begins with identifying the right clinician to join the team at the school and really making sure that they're a part of the fit and the culture for the school environment.
We were concerned with being able to find a provider. Debbie was available. Really, we just decided, and Healthy Minds requested, that we have her as part of our staff.
I've had a lot of kids come in that start with really big, overwhelming emotions, and they're getting in trouble in school because of it. They're at risk of hurting someone or themselves. So I had one elementary student who started coming to me. He would go home frequently because of stomach aches or headaches. They kept wondering if it was more of a mental health issue instead of a physical issue. And so he started working with me. We would work on specific coping skills, different tasks for him to do. And after a couple of weeks, he came to me, he's like, do you think I might have anxiety and depression? I'm like, well, yes, I do. That's why we've been doing this and this. This is specifically for depression. This is specifically for anxiety. And he had the biggest grin on his face. He's like, I figured it out, and you knew it before me. And these things are helping me.
The kids love her. They really do. There's a sense of confidentiality with Debbie that where she's separate from the school that I think builds trust between our families and her.
It's the most convenient for families. Their student can see the counselor right at school, and they don't have to be checked out of school. They don't have to have transportation to the counseling appointments, and it just makes it much easier for the student to be able to have consistent work with their behavioral health provider.
It is a benefit to the children, the teachers, the principal, the community as a whole, because we're providing a service directly to a student when they need it most, rather than waiting until it is too big for them to handle in a place where they can get easy access to it.
Now we've expanded to 8 schools, I believe, total. Truthfully, I would expand it to all 22 schools that I have, elementary and secondary, if we had the counselors to fill those.
My hope would be, as a system, that we're able to support each child to help bring up contributing adults to our society that maybe can leave this place, one, loving it here, I think that's really important to me, but two, just having those social foundations that they're able to be successful.
I've been all over the state, born and raised here, and recognizing that the work we're doing is so impactful and we're creating lasting change.
To be able to restore relationships, be able to, give kids the skills to self-regulate and learn on their own, rather than consequence or masking it with, I'll take care of you. It's not for you and it's not to you, it's with you. We're going to do this.